them and be able to repeat it, to duplicate it, to just share it without having to do a major translation of their own. And so we show respect for them when we deliver materials to them that are very much ready for their population, as opposed to, just taking something that's a one size fits all. So we'll talk about this more as we go on. So plain language, that is really important to promote KOHA and oral health in general. And let's take a quick look why. So adult literacy levels in the United States, earlier this year, the U.S. Department of Education came out with this data. Now, what they found in a nutshell was you have roughly 41, 42 million people with very low or low literacy skills. Now, when they say they're unable to measure, that's a reflection of language barriers, which are really kind of an additional layer of barriers to understanding and education. So there's that issue. Mid-level literacy, what the experts tell us is that at that level, people can understand the key point, but they can often struggle to understand more nuanced information and maybe can't distinguish as easily between other levels of prioritization, what is most important for them to remember, or how to make sense out of data or a statistic that may have been shared. So really 108 million adults in the United States who really, because of their literacy levels, create sort of a challenge. Now, keep in mind, this is adult literacy levels. This is not health literacy, which can add a whole nother layer to this, right? And this is why we talk about the importance of avoiding clinical and technical terms as you go out into your community and as you provide fact sheets and FAQs and you're delivering talks and you're engaging stakeholders, really trying to sift and boil it down. Just very important for us to keep in mind. And some of you may have seen this example that is, I believe, on the CDC's website that sort of shows certain terms that just are not going to be readily understood by millions and millions of people. So keeping that in mind is foremost. So I managed some focus groups last year in 3 different states. We had focus groups in Texas, West Virginia, and Maine, 3 different areas of the country. And what we found was 2 of those sets of focus groups had to do with influencers. And many of you may understand that term. Basically, these are people who are deemed influencers because they tend to follow news and civic developments, political issues more closely. They tend to get more involved in writing letters, attending a rally or a march, those kinds of things. Even influencers told us that many of these terms they weren't quite sure of. They weren't quite sure exactly what they meant. And so it's just important for us to keep in mind in the literature that we put out, the web content we post, that we take that into account. For example, in one of the focus groups, somebody mentioned that they thought health provider meant the insurance company. So, it's just important to keep that in mind. If you introduce that term without context, you're going to have some people who won't understand. A lot of this boils down to how we write and how we speak. So when it comes to writing, kind of from a plain language perspective, it's not just the terms we choose, but it's also the length of those words and sentences. So, really trying to shorten our sentences, keep them under 25 words, even under 20 is ideal. But, making sure we're not producing those 45, 50, 55 word sentences that can be very difficult for people to follow, force them to go back and reread, and that can frustrate them and make them move on and stop reading. It also means shorter paragraphs, right? People kind of skim a web page or they skim a fact sheet and they make this mental note. Okay, how much time are they asking me to invest here? And a lot of times it's not just the total length, it's how dense the material looks visually, not just in terms of wording and grammar. So if you have really long paragraphs, that is not a very welcoming kind of visual. People want a sense that they can sort of browse, read, that if they miss a sentence, that doesn't mean they're not coming away with important information. So the way you package it has a lot to do with this. I also think it's important to evaluate what we've written, what we've drafted for web, for online, for social media, for, you know, printed materials that we can take out like fact sheets and FAQs. Look for lazy words. These are, I call them lazy words because these are words that take up space, but they really aren't working for you. They're not necessary for understanding. And so they take up space. They make sentences longer that don't need to be longer. And here's sort of an example, right? So this sentence is very, very close to one that I read on a health department's website in the US about a year ago. You know, this is a very admirable goal. Nothing to argue with on this, but they took an awful lot of words to say something that probably could have been boiled down much more simply. They used a lot of introductory phrases and kind of verb tensing and stuff like that that just really wasn't necessary. So, you know, this is one example of how you could take something more complex and just really boil it down, make it more accessible so people understand, you know, what you're talking about. Back to the visual piece though, you know, how you package it, how you present it is important. And so, you know, just having one paragraph of text after another paragraph, even if it's relatively short, it can be a bit monotonous. And one of the advantages of using icons, whether they're round or square or check marks or something, is it really helps to guide the eye. It gives the eye a bit of a break from the monotony of reading line after line. So, you know, having subheads, pull quotes, things like that are going to be very important for readers in the materials you disseminate. Those of you who want more information on plain language, there is a great website, plainlanguage.gov, that has been set up by the U.S. Department of Health and Human Services. Definitely check out some of their resources. And the CDC, several years ago, created this resource, Everyday Words for Public Health Communication. They have some specific examples of terms that they recommend not using and the term that would replace it for people with limited health literacy. So, you know, I think it's a really helpful to kind of look there if you want to dig a little deeper and make sure that you're on the right track. We talk about clarity, and I want to talk about clarity as it regards data, right? We all have statistics and numbers and fact sheets, and, you know, we throw a lot of data at people in this world. There was an article in Forbes magazine recently that said that the amount of data generated in the last 3 years is more than all of the data generated in the previous 1,000 years, which is a pretty astonishing statistic itself. So, you know, there's a lot bubbling up. There's a lot of charts and graphs and things. And so I think it's just important to be really strategic as you go out and you talk about oral health, you talk about KOHA, that, you know, you're keeping any data or statistics to a minimum. Throwing 5 or 6 stats at them is probably going to be just too much. So, you know, really choose strategically. What data point, maybe 1, maybe 2 at most, do you really think is going to have the biggest impact? It might make parents and other stakeholders just kind of step up and take notice. Like, wow, I didn't know that. You know, something that that you think could be helpful in that regard. Very, very important. You also want to think twice about using charts or graphs, scatter plots. You know, a lot of these are created by the epidemiological side, the statistical and data people within health departments. They're great. I'm a geek. I love diving into this stuff. Don't get me wrong. But, you know, you really have to think carefully about when you know, this becomes too much. When you throw something visually at a reader that many of them may struggle to make sense of. And, you know, it's one thing for somebody who really is used to data and statistics to say, well, I understand it. But again, this is something where you probably don't want to trust your gut. You really want to vet this internally. You know, will this make sense to them? If not, you probably want to think twice about it. Using ratios instead of percentages can be a really nice, more conversational way of talking about what's going on in the community. You know, if you want to talk about how many kids are going without getting a kindergarten oral health assessment, or some other data point, what your third grade tooth decay prevalence is. I think it's really, one alternate here is, instead of the percentage, to actually use 1 in 2 or 1 in 3, or, whatever might be the case. So just a different way of representing the statistics. So just think about that. And then even in your more detailed documents, I tend to discourage people using, decimal points on the right side of a percentage, unless you are really trying to distinguish, say, 2 different topics, and you want to know which one was slightly higher than the other one. But this kind of data is really not all that important for the reader, and people tend to slow down when they see that. Instead of just saying 29%, 29.8, or instead of saying 30, readers tend to slow down, and you're actually asking them to remember 50% more, because instead of 2 digits, you're giving them 3. So just kind of keep that in mind as you share data and incorporate it in your content. So being proactive here is really what it's all about. I mean, to generate a conversation and build awareness. People do take their cue from you. Local health departments, when you're talking about it, people suddenly say, wow, this must matter. They wouldn't be bringing this up if it didn't. So, anything you can do to just start a deeper and wider dialogue in your community is going to be helpful. And that's why I think it's really important to start talking about where you might be able to give talks or presentations to key stakeholders that will help put KOHA, on their radar screen, and maybe lift it up. They may be aware of it, but just to really underscore the importance of this, make it clear that it's a priority and so essential for kids. Trying to come up with this, I think, is just, coming up with a plan and doing outreach is going to be important to making KOHA matter to others. There's a template of slides I think all of you should have, or your department should have received, that is designed to promote KOHA. That template of slides can be used as you go out and make presentations and as you deliver talks. On slide 21, there's some customization possible, also on slide 25. So, this is not meant to be a strict script for you. It's simply meant to get you started, and you should feel free to add a slide or 2, subtract 1 or 2 or 3, depending on the time you have. All that obviously we expect you to be your decision and your judgment, and understandably so. There were talking points that were also distributed on KOHA, and these are primarily directed at educators as the audience, and that's why we really promoted the notion of school readiness as being important. That is something that we think is very, very important. But we also realize, depending on who you're talking to, you may want the emphasis to be a little different. You may, if you're talking to, a local chamber of commerce, their concern is certainly going to be a little different than the education community. And so taking into account the fact that, children become adults who enter a workforce, and if they've had years and years of oral health problems, that's not going to play out well for local businesses and for economic vitality. So, just being, as strategic as you can. And then, you've got partners that you've established either directly with the oral health work or with other related issues, children's health and public health. And, this is a great opportunity to, circle back to those partners to help promote KOHA. Many of them will appreciate you offering to write an article for their website, their blog, that kind of thing. They're often looking for content. We don't have quite enough here, so, don't view it as an imposition, and the talking points that were shared, they can kind of serve as the nucleus for that article or blog that you write. So consider that. Some of them, regularly put on an annual conference or participate in some kind of regional or statewide meeting. this is an opportunity to offer to conduct a workshop or be part of a panel that talks about children's health, and I think it's important to make it clear it's not just that you only want to talk about KOHA, but can you connect KOHA to other things that they're interested in that they would be likely to want to have a workshop about, right? So if the panel is about school readiness, you've got a great reason to talk about KOHA, and maybe there are one or two others that are talking about behavioral health or some other issues. So really think about how to kind of connect dots here. Infographics and other visuals. Even if they don't focus on KOHA specifically, they can still be very useful, start getting interest, drawing people in deeper to learn about oral health and dental access. Op-ed columns, same thing. If you have a local publication, it can be a really good opportunity there as well. I think we take this for granted, but, as you reach out and as your partners step up and let you kind of play these roles and work with you and echo your messages, I think it's just very important to show them some love, to really make it clear that you appreciate their collaboration. I'm sure 99.9% of you do this, but, it's a great way to really nurture that relationship, because you're going to want to turn to those partners on other issues, not just oral health. So, health fairs, they happen in communities, every few months here and there, different parts of California. They've got, regional or county or local health fairs. And so, this is an opportunity to bring KOHA to this kind of audience, this kind of venue. So think about, what's planned, what's going on. Is there, a special way you could display materials related to preschool age oral health and KOHA? Are there, what would you bring there? As a one-pager, is a pretty simple fact sheet that you've got, that you really think a mom, dad, or caregiver could pick up and, truly understand, what they need to do to make sure that their child gets an exam. So, just making that clear, leveraging these events and activities, very, very important. Engaging educators, also very, very important. Obviously, a lot of the talking points and the slides are really directed to education professionals, education administrators, principals, teachers, others, to make that connection between having healthy teeth, healthy mouths, and being able to perform in school, attend school, and perform well. So we know that's important, but this is a little different. So, there are local preschool programs in your area. There are obviously Head Start programs. I think many of you know Head Start is federally mandated to include oral health content in their programs, and that intersects not only with the children who are there, but also with the parents and the caregivers. So that's fine, but it would be interesting to have some dialogue with local Head Starts. Is the KOHA mentioned? Our Head Start staff actually handing out something to make sure that parents, of 3 or 4 year olds are, aware of KOHA. So they begin to think about it and plan about it. So much of this is about normalizing what children should receive, the services they should get before they get to school, and really just getting people to understand, this is one of those things I need to do. Okay, I understand it. So, I think, if you can get Head Starts to maybe have something they can circulate, just to make sure that the oral health lesson connects with KOHA, I think is a real positive thing. And then, of course, you have a variety of preschool programs operating locally that aren't, a part of Head Start. And, making sure those educators are aware is certainly a worthwhile effort to make. And, mentioning it within the context of oral health related learning activities, always a good idea. So social media, I think is something that unfortunately is underutilized by the public health community. And I say unfortunately because, we do not have endless resources. We unlike the corporate world, we can't just sort of, reach down and get, pull aside or divert another $50,000 or $100,000 and put it into this program, right? We're public health departments are very cash strapped. They really rely on whatever funding's given to them. They've got to make it last. They've got to make it work. They've got to maximize every dollar has to count. And so in that environment, I look at social media, and I won't say it's a no-cost vehicle, because I think time is money. You pay your staff to do certain things, and they have roles and responsibilities. So there is some aspect of cost into it, but it is certainly low cost. And given how many people are on these channels, whether it's Facebook, Twitter, Instagram, TikTok is suddenly a big thing. There are all these platforms out there, and to not utilize at least one or two of them, I think, is a missed opportunity. And I think it's missed, as I said earlier, because it is low cost, but I think it's also missed because the whole nature, and we've all heard this 100,000 times, but something going viral, right? Well, that's a fancy way of saying your message reaches someone that you just never could have imagined it would reach, right? So, everybody, whether it's Twitter, Facebook, Instagram, other platforms, you've got followers, and as you know, not even all of them will see your message. But the beauty of sending a message out that is interesting, that is provocative, that is informative, tells somebody something they didn't know already, means they're most likely to like it, to engage in some way, to retweet it. And suddenly you start reaching people that you hadn't expected to. Hashtags in that respect are really critical for helping you break out of the silo, right? Because you just want to talk to people who already are following your messages. And we'll talk a little more about hashtags momentarily. So also recommend, recognizing, and I think this is one reason why maybe social media is underutilized, is the nature of internal review. Health departments want to be mindful of what's being posted and what's going out, which I totally understand, but it can require a lot of lead time. And so it means that for a lot of state health departments and for state and for local health departments at the county level, et cetera, that they have to go through an internal review that may take days, it may take weeks in some cases. I've talked to a variety of communicators. So really makes sense to square away some time where you are writing and drafting these messages, and so they're ready and they can be submitted and approved. So when February, Children's Dental Health Month, arrives, you're not caught sort of flat-footed saying, oh my gosh, we should try and get some messages. Are we going to have time to get them approved? The advantage too here, is that, as you create that content, again, people, your partners, they can retweet you, they can share that content. So, it's an important way. You may say KOHA is a priority and oral health is a priority, but, I think one way you demonstrate that is making sure that those messages are periodically, once, twice, 3 times a week, kind of channeled through your feed. So, and then the third thing, it kind of goes without saying, but a lot of times, people sort of like, hey, we got this message out, great. But, letting your key partners know a week or two in advance, hey, February 2020 is Children's Dental Health Month. We're going to be kind of generating some content, especially on February 1st. Definitely look out for it. We would encourage you to tweet and here's the hashtag that we're using. So, just really making them aware. Again, a lot of your stakeholders, they're looking for content too. So if they can sort of retweet something, it almost, or share a Facebook post or something else, it kind of helps them do some of their task, completion as well. It generates content for them. So definitely want to keep that in mind. Many of you are aware of, Twitter chats and Facebook events, Facebook Live, and social media storms. There are a lot of different names for these, but I really encourage you to, if you feel like you can't host it because you don't have the bandwidth or co-host it, find a stakeholder in your county and your community that would be willing to take the lead on something like this. You might be able to help supply them with content, or you might also co-host it. So think about that. And the event doesn't necessarily have to be about KOHA specifically. You're more likely, in fact, to get interest when the topic is children's oral health in general, right? So that opens the door for people to talk about other aspects. But, you know, you can get KOHA into that conversation. And sugary drinks, I think, is a good example of a topic that you would think is way off track from KOHA, but it's really not, because if there's a social media event about sugary drinks, you know, obviously we know sugar plays a major role in fueling tooth decay. You know, it doesn't take a lot of expertise to kind of connect dots and use that as an opportunity to mention KOHA to people who might not be aware of it. Last but not least, I really encourage you to create a social media kit. So you'll have messages developed, but, you know, instead of just using them for yourself, writing some extra ones that you know are evidence-based, that you know align with where you're going as a department, you know, is a great way to help partners in the community who do want to be active, who do want to kind of echo your messages, to have content they can use, and they can maybe adapt it slightly or add a different hashtag to it, right? But this is a help, and I found in numerous cases that you get many more people involved when you make it simple. And a lot of people, as you know, a lot of stakeholder groups, they don't have a full-time person who's only doing social media. That's a luxury. And most of them, that person is wearing 3, 4, 5 other hats. So when you give them content they can take, copy and paste and use, they are much more likely to engage. So let's step back and talk just for a moment about messaging on social media. You know, a lot of the key message points and facts supporting KOHA are not necessarily happy ones, right? They are, tooth decay is the most common chronic disease for children and teens in the U.S. We also talk about the number of you know, days that have been missed. You know, there was a major study done by UCLA showing a huge number of days missed by children because of dental problems. You know, so there's also a need to be aspirational, right? To look at down the road and tell people, yes, we feel good about this. We feel a sense of hope. We can really address this issue and move forward, make progress by doing A, B, and C. So, you know, having messages like this, they can be simple. They can be, you know, really both visually and content-wise, engage people, give them a sense of not just the bad news, but tell them we can do something about that, and here's why. Offering tips and tools is very important too, right? And these don't have to necessarily come from you, but looking at respected, well-established organizations like the American Dental Association, the California Dental Association, the American Academy of Pediatrics, the American Public Health Association. A number of these have different content, different tools, tips, worksheets, things that are very shareable that people kind of like to get. And so, you know, here's a freeze frame of a video. This was posted on ADA's Facebook page. You know, when should I start brushing my children's teeth? Well, there may be a lot of parents out there that aren't really clear on that. And so, you know, this basically tells them, we're going to answer your question. We're going to try and make, you know, you keeping your child healthy just a little bit easier. And so, you know, that's helpful. Salud America, a Latinx organization. They're based in Texas, but they have a presence on social media that is very large. And, you know, they have some report card they were sharing, right? So, I mean, just, you know, giving people resources and tools and tips, that's something that people tend to like, and people tend to share that much more likely than they would just, you know, sharing a fact with them. Videos and graphics, also very important. You know, statistics consistently show much more engagement from people when there's a clickable video or a clickable graphic of some kind. So, you know, take a look around. Your department may have created some stuff. You know, there may be stuff that's out there online that other stakeholders have created that might be worth sharing. Obviously, you know, you're wanting to stay away from political content, but there's a lot of stuff out there that could be useful. And in just a moment, I'll give you some ideas of where you might look. So there are YouTube pages where there are a lot of consumer-focused videos that you can access, and these are three organizations that I think, three entities that I think you'll find some useful stuff on there. And I want to emphasize, I'm talking about Delta Dental. Delta Dental Insurance Company has a totally separate YouTube page. I'm not talking about the insurance side. This is the Delta Dental forward-facing side that has a lot of interesting tips. You see the freeze frame about when will my baby's teeth come in, questions like that. That kind of engagement, really starts to pull people in and starts to just establish that, our health department wants to make sure we get you the information you need. We really strengthen your ability to raise your family, to put your kids on a great path, for health and happiness. So, that's really what this is all about. Visuals are very important as well, right? So, people tend to think of them a little bit as an afterthought. Oh, here's my message. We got this. This is great. But I really want to point this out. And many of you, I think, will get this immediately, but it's something I still see occasionally from dental organizations or public health departments. They're kind of looking for a photo online somewhere to grab and sort of upload just to kind of add a visual element to their Facebook post or their tweet or what have you. The problem is occasionally people will grab graphics like this one or a photo that shows a patient with lots of these dental tools right next to them, getting worked on. Those really are not the images we want to share. I mean, I think there are some positive ones in a dental setting, but I would really steer clear of ones that are images solely of dental instruments or where dental instruments are, inserted in the mouth and all that. That reminds people of the negative aspects that many people don't want to think about. They don't want to immediately focus on, I'm going to have a dental hygienist or dentist who's going to be leaning forward and, poking around in my mouth. We really want to help them think about oral health in a different way, that oral health is about maintaining good health. And, we really want to focus on the benefits of getting care and not sort of present this in a way that kind of reminds them of the negative aspects that can create a sense of anxiety in a lot of families. Hashtags, I mentioned those earlier. So they help people find you. That's why they're so important. And so, you really, as you write something, if depending on the topic, you may want to kind of think strategically, well, hey, how do we really reach the people we want to reach here? And that's what this is about. And so, for example, KOHA is the kind of thing that to me is really an important tool in our overall strategy to help achieve health equity, to make sure that all kids are put on a path toward health and success. And so, this is a common hashtag. If you go onto Twitter or Facebook or other sites and you type this in, you're going to see quite a few posts using this, posts about health equity and disparities issues. Likewise, kindergarten, right? That's kind of a no-brainer, makes sense, right? Well, there are parents and other early childhood experts that will use that hashtag a lot for information related to early childhood. So, that's something to kind of think about as well. School readiness, right? That is in many ways at the center of why KOHA is so important. And, beyond that, there are even hashtags that pertain to the parent community within a county or city, right? So there's a hashtag East Bay Parents. So, in the Oakland, Berkeley, Alameda County area, you've got sort of a customized hashtag for that. So, think a little bit about that, because how far your message goes and who sees it is shaped by hashtags. And as you start to push out and you are doing these things and you want to kind of be able to monitor and see kind of, hey, I wonder how many people have participated, or did anything get retweeted, or, you might want to come up with a customized hashtag. I definitely think it's worth considering. And what it basically means is you have a hashtag that you personally use in all of your, KOHA related messaging, but you also encourage your stakeholders, your partners out in the community to do the same. And when you develop that social media kit, you can include that hashtag directly in there. So this is just one example of what you might use. I'm not necessarily recommending that. Who to follow? There are a lot of options, and this is by no means, an endorsement, but, these are, making sure your Twitter account or your Facebook page or whatnot, that they are connected with some of the key stakeholders. You might get followed back. They might be more likely to share your content. So just think about who in your space, statewide, in your region of the state, you might want to follow. That just kind of can help take your reach to a new level. Calendar events. We talked about Children's Dental Health Month in February, but don't think that it stops there. There are a lot of other ways to connect dots to oral health and talk about KOHA. And given the timing of KOHA, that can be a real important thing to do. Look at National Women's Health Week, right? Late in the typical school year. That can be a time to speak to mothers and talk about things they can do to take care of their kids and keep them healthy. And, KOHA could lean into that. That could be a way to do that. Every Kid Healthy Week. So really look at calendar events that are coming up and kind of align some of your messaging with those. Community bulletin boards and blogs really encourage you to think beyond some of the obvious selections. There are community bulletin boards, there are parents' blogs out there. They can kind of help you move the message of KOHA. Reaching out to them, not a bad idea at all. This is just one quick example. The city government actually maintains a community bulletin board. I have no idea, but I suspect they might be open to someone who wants to post info about KOHA on there, just so parents might be more likely to see it. Patch, some of you are familiar with. They have basically localized sites everywhere, but it's sort of a national kind of thing. But any events that are going on, community health fairs, others, definitely a way to promote the events, but also, you can join the conversation. And when health comes up, or maybe you start the conversation mentioning on these platforms about KOHA, that's a great way to engage people as well. So next door, also a lot of neighborhoods, a lot of communities in California have next door pages, something to kind of keep in mind as well. And so that brings me to a close. I know I've covered a wide range of things, a wide range of communication tools and platforms, but I wanted to give you a sense of, the breadth of what is possible depending on your expertise, depending on where you have more bandwidth. But I think those conversations in particular that you can have, giving talks, giving presentations to people, is a good way to make the message very clear that KOHA is something that's important, and we want to get more kids who are actually getting those assessments. So I'm open for any questions or comments.
All right, well, thank you, Matt. We'll go ahead and take some questions for now. Just a reminder, please be sure to type your questions in the chat box. All right, and then for those of you on the phone, I'm going to go ahead and unmute.
I have to do that. Yeah. But that's actually in my scope of work with that. Why when I'm telling the state, they're like, oh, good, you do that too. I go, well, I did, and I got in trouble.
Keiko, I just want to reiterate what you said, that anybody who wants to contact you or me, I'm certainly ready to lean in whenever somebody has a question, if they think of something later this week or next week about anything that we talked about in this presentation or any related challenge they might have. I'm certainly happy to get a question from them and talk it through and help them plan or strategize.
I think there's a question in the chat. I don't know if you saw that.
Let's see here. Okay. Yep. Let's see. Yeah. Resources as they relate to communications, I'm assuming that question is focusing on. I don't know if you're what particular type of resource you're looking for. If they want to type in a little more explanation of the challenge that they really kind of want to tackle, or if they're just wondering if there are other resources that we have focused on rural communities. I don't so far. I mean, I don't have something on that, but if I'm misunderstanding the question, please type in some more information, and I'll do my best to give you a useful response. This presentation did not include press and media outreach, and so I just want to remind those of you on the presentation or on the webinar today that we are going to be taking a deeper dive into media outreach, how to plan that, how to execute that. That's going to be the next webinar. So just in case some of you are wondering why we didn't delve into that, I think there's enough involved in doing that successfully that I think it's really kind of worth its own presentation. So I look forward to engaging with you on that.